Welcome to Internet Safety, hosted by Donna Rice-Hughes. Over the next hour, you'll learn practical and crucial tips on how to keep your loved ones safe in the digital world. Now, here is Donna.
Hello, welcome to our show. Thanks, everyone. I am your host, Donna Rice-Hughes, and we're here to talk about protecting your kids in the digital world. And we realize that that can be very, very overwhelming. And our goal is to educate, equip, and empower you to prevent the online exploitation of your children and your family. And we have an incredibly special show lined up for you today. I am very excited about our guest. We're going to be talking about online gaming and internet addiction, the lure, the dangers, and the cure. The internet opened up a whole new world when gaming was introduced. And if you have a child in your life that plays online games, you already know what I'm talking about. This is a powerful, powerful phenomenon that we are dealing with as families, and that is our kids and our grandkids playing online games. We've got our special guest, who is Dr. Andrew Doan, and he is a rock star in his space. He's an internationally recognized speaker, author, and online gaming expert. He specializes in ophthalmology, aerospace medicine, neuroscience, and public health. I mean, that's a lot of MDs and PhDs right there. And his degrees are from Johns Hopkins. He spent 3 years with psychiatrists and psychologists to research media addictions and has studied this issue for over 13 years. He's trained 2,000 healthcare providers on media and gaming addiction. He is the author of Hooked on Games, The Lure and the Cost of Video Game and Internet Addiction, and he also wrote Digital Drugs and the Struggle for Connection. Welcome, Dr. Doan. It's so great to have you.
Thank you for having me. It's great to be here.
So we're going to start with some statistics, and you can probably even give some new ones above the ones that I'm going to share right now. But these came from the Internet Software Association, so in 2023. 212 million Americans play games regularly. The average video game player is 32 and started playing when they were 21 years ago. So that makes them about 11 years old, according to this. A quarter of American players are under 18, and 90% of youth say that they're playing video games on a regular basis. And here's another one. This has to do with online predators and traffickers. There was a British children's charity that said Fortnite's chat systems leave kids vulnerable to contact from strangers, reporting that 25% of children playing games may have been contacted by a stranger. All right, so that's a whole lot for our audience to take on, but it's not a whole lot for you to take on, Dr. Doan. But as we start here, first, would you share with our listeners how you got into this issue of online gaming?
I'm a pretty avid gamer. You know, I grew up in the time of Atari and Commodore 64 before internet connectivity became plug and play. And so it took a little work to get online, and we had to use like modems and 5G modems and so forth in order to get on connectivity, or 300 baud modems. And so during that time, I was playing like Doom and Civilization and these games, and as a way to cope during medical school, I just got sucked in once I got internet connectivity. We used this program called Kali that basically it's spelled Kali. What it did was it tricked the laptop computers and the desktop computers into thinking that a modem connection was an IPX network protocol, meaning that it's a LAN or a wired connection. That allowed people to play games together that could not play before.
Mm-hmm.
And so I ended up playing 80 to 100 hours a week for over 10 years. Pretty much played any game out there and got really good at online games. And my son even got involved. Since, I was involved, he got involved, and that's how we spent time together. But we finally, when I got older and I had to work, and, it was easier for me to leave the games behind than it is a child. So I played from like age 25 to 35, really hardcore, but my son tend to struggle some more. And so that's when our family really had to rally around our internet use guidelines and develop tools and start to dive into the research studies. And that's how I got involved. And so when I started hearing, like, for example, my colleagues that were other doctors who had kids who were failing out of college because of games like World of Warcraft.
Hmm.
And I'm like, I know what's going on. I had been there when I
Right.
started asking questions and just talking to these parents, and I hear that these are doctor families that were having kids who were playing 80 to 100 hours a week, but
Well,
they really struggled with that and they flunked like straight Fs out of multiple colleges. And that's when I dove into the research literature. So being PhD trained in neuroscience, at Johns Hopkins, we're we're trained to do research. And so the first place I go is the research literature to see if anybody has written any case reports, are there any research papers on there? And to my surprise, there were half a dozen papers back in like 2010,
right.
2009, when I first
Hmm.
dove into the research literature, six papers on this topic. Not very many, but there
Right.
were six. Then what's interesting is that if you fast forward until now, 2024, there's over 1,000 research papers on this
Hmm.
topic.
Right. Right. And the numbers are huge, like we saw in the beginning. So, as a neuroscientist, obviously, you've studied the impact of excessive gaming on the brain. What does this do to the brain? Because you've got a lot going on here, right, doctor? You've got screen time, you've got all of the hooks and the connection and the excitement and the competitiveness of a game, and then sometimes you mix, you've got violence mixed in there or sexual content. We'll talk about that in just a little bit. But what does just gaming in general and excessive gaming do to the brain?
So a lot of times people talk about dopamine, and people understand that dopamine is a reinforcement neurotransmitter. Some people will mislabel it saying it's a feel-good neurotransmitter, but it is actually a neurotransmitter in the midbrain that controls behaviors. So if you like a behavior or like a certain thing, or even don't like a certain thing, dopamine can fire. But as a neuroscientist and also as a medical doctor, I dove into the research literature and I found papers like, oh, just adding music to a video game will increase cortisol in the salivary secretion, in the saliva. And I'm like, wow, that's a really cool concept. So that means that when I hear music and it hits my eardrums and stimulates my auditory cortex, and then my midbrain fires off dopamine because I like the music or I hate the music, it actually goes down further and stimulates the hypothalamus, pituitary, adrenal axis to then stimulates the adrenals above the kidneys to basically secrete cortisol. That's incredible. So therefore, music being a substance that we can't really ingest or inhale will stimulate the brain and body kind of like a drug. Like if I
Wow.
gave the drug steroids, by listening to music, I can stimulate it like taking steroids. So then there's other studies to show, well, you add like um, if you have two players who play video games together and they're both human, they, instead of a computer opponent or an AI opponent, the two human players will have testosterone be higher than if they were just playing against a computer. Well, let's take out that, let's look at that pathway. That pathway means the brain, midbrain, dopamine system, hypothalamus, pituitary, then gonadal, the testicles, will then secrete testosterone.
Oh my.
There were other papers that show that when kids play video games, their metabolism was up through the thyroid mechanism. So that's hypothalamus, pituitary, thyroid axes. And then there's now papers that show, research articles that show, especially out of University of Washington, that you can use video games to numb pain by 62%. That can be used to scrub the burns off of burn victims. So when you
Mm.
have a virtual reality game, the both patients who are kids and adults will want to play the games just to get the burns scrubbed off of their wounds because they want to play. It's engaging, it's fun.
So
But
so this is
that's also the endorphins axes now too. So it acts like a drug. It acts like a drug in the body.
okay. So you just hit on benefits. So before we get into all the nasty downside, and there's a lot. All right. So parents, grandparents, stay tuned. We've got a lot to cover here. But there are some benefits to games, right? Can you just like in layman's terms, what are some of those benefits? She talked about pain relief. What else?
Sure, you can also use to treat like trauma. So, for example, in a traumatic event, if a child or an adult starts playing, like, let's say, Tetris, they can actually forget about that trauma and lessens their post-traumatic stress disorder
Mm,
risk factor down the road. It can also help with learning and memory. We can use games to enhance our memories, mainly probably because cortisol and adrenaline and all these hormones are being released into, the body, right? That can
right.
enhance memory and learning. We can also use gaming to as a highly effective teaching tool. So we
Yeah.
use, like, for example, first push person shooter like type games in order to train police, military, and law enforcement, for example. And they're
Right.
highly effective tools. And then we also use it medically. So, for example, for pain reduction that I mentioned with the burn scrubbing, but also for, let's say, childbirth and other medical
Mm.
procedures that are uncomfortable, these digital media modalities can be very effective in reducing pain and discomfort during medical procedures.
Okay, so we're going to get down to kind of the dirty dangers, and I've read a lot of what you've done. I've heard you on various podcasts and videos and whatnot, and you talk about mood disorders, anxiety, depression, ADHD, addiction. Okay, we got into the kind of the brain stuff and the hormone stuff, but let's bring this down to what layman's understand. Let's just say I'm a grandparent. I've got 5 grandkids. Two of the boys have been playing online games for a long time. Um, what might I see as a result of that, or what might any parent see as a result of video games and online games, and what should we pay attention to? And how do we know? Okay, I just jumped to my next question that let's just say an ADHD situation or increased anxiety might be the cause of gaming as opposed to just something else.
So one thing you can try is look for symptoms of sleep deprivation.
Okay.
Behavioral addictions, particularly like gaming and social media that we're talking about, and excessive phone use, requires the child to live life and also to try to manage their nighttime. And that's when they sneak in extra hours, right? Of playing is when they should be sleeping. Instead, they are playing games or on their phones. So if they are sleep deprived, then that's when there could be a potential problem.
Hmm.
When you ask them to cut back, for example, they may get really agitated. That could be a sign of an addictive problem that needs to be addressed.
Right.
Or they're acting guilty when they're playing, like they're sneaking off, or they're lying about their playing. When you're asking them and they played, but they purposefully lie so that they can get more game time, for example.
Right.
And if this is the only thing they talk about too, so every day, every morning, if that's all they're talking about, and that's what is the number one thing on their mind, that could be a problem. That leads to now mood problems, like, for example, ADHD problems,
Hmm.
uh, emotional problems, depression, anxiety, cutting behaviors. The beautiful thing about this is that if you look at Dr. Victoria Dunkley's work, she's a pediatric psychiatrist who wrote the book, Reset Your Child's Brain.
Oh, good.
What she shows that basically if you unplug a child and do a detox, you can actually go to my YouTube channel, and I have a detox methodology that you can go through. It's a video that's called Digital Detox, and my channel is at Dr. Andrew Doan. But we talk about Victoria Dunkley's work there. Dr. Dunkley showed that by taking the screens away completely, all screens for 1 month,
Mm.
because the child's brain is so resilient that all of these problems that you're talking about, Donna, ADHD, depression, anxiety, angry outbursts, poor grades, all these things, talking back, all these things disappear in 1 month.
And we're
1 month.
talking 1 month. So I just want parents and grandparents listening to this to recognize that right now our focus is online gaming, but this is any screen. Take any screen away for 1 month. Am I right, Dr. Doan?
That's
For
correct.
1 month. So that's a smartphone. It's kind of hard to take away a computer or a laptop because so many schools now require it. But then you can limit that. And we'll get to that when we get to safety. 1 month, you can start to see these kinds of symptoms virtually disappear. Am I right?
Absolutely. It's
Okay.
amazing. It's
That's
amazing.
incredible. That's incredible. So let's talk about something that you're quite an expert in. You're an expert in all of this, but it's virtual autism. This is not a term that I was familiar with before I started preparing for this interview. Would you explain to our listeners what virtual autism is?
Sure. So let me describe that. Basically, back in the 1970s, the rate of autism was about 1 in 5,000 children. We do have better recognition. We do have better diagnostic tools. We have better awareness. The CDC has said within the last year, autistic rates are at 1 in 36.
Mm,
It is increasing exponentially. So the big elephant in the room is this virtual autism. And what I mean by that is that in ophthalmology, and I'm going to take some time to explain this so people understand. If I
please.
have two eyes and one eye is misaligned, this eye, the brain will start turning off that eye and disconnect from it.
Mm,
So a child who's at 1 who has a eye that turns out can literally lose this eye by the time they're 18, by the time they're 10, if we don't intervene. But
okay.
how we intervene is that we straighten this eye out, we give it glasses, we do surgery, but then we also block the good eye. So we actually patch the good eye for about 4 hours a day,
Mm,
force the brain to work on the bad eye, and within literally 6 months, we see normal vision return in the crooked eye, the strabismus eye.
right.
Same thing is happening in the frontal lobe. So the frontal lobe that controls eye-to-eye contact, communication skills, patience, all these higher executive functions that we desire in children. If they're looking at one screen and only a type of video or a game incessantly, 6, 8, 10 hours a day, their brain will actually atrophy in other areas that are
Mhm.
not being used. And that's
Correct.
what we're seeing as being autistic symptoms. So when I see them, they're usually 2 or 3, and the parents are screening for vision problems that could explain their delay in development, their delay in speech. But when I look at them, their eyes look okay. I'll take a complete history and find out that they're looking at the iPad 8 hours a day for whatever reason.
And
It's what the child
how old
likes,
are
or
these kids? You're 2 and 3 years old?
sure, we see it all the time, right? I
Yeah.
mean, think about all the little babies in the
Yeah.
shopping cart that a parent puts a phone in front of their face and plays a cartoon to keep them quiet. So you remember
Yes.
the digital anesthesia, the reducing of pain with
Yes.
screens. So that's what we're doing with these kids. We're just
Right.
putting screens in front of them to reduce their pain, their discomfort, to keep them as a convenient, um,
Quiet.
exactly.
It's a digital pacifier, right? I've been working on internet safety, Dr. Dome, for 30 years, so that I'm aging myself right now, and I'm aware of this. And we always say to parents, please don't use these technologies as a babysitter, as a pacifier, or anything like that. But I tell you, when you've got a screaming 1-year-old in your lap, like I did at one point, with this child just wouldn't stop, I picked up the phone. Real story, not to give it to him, but to call his parents and say, what do I do? I was almost in tears. This has been going on for hours. This child, honest, reaches out. This is the old Blackberry, reaches out and starts trying to move the screen and was quiet. I'm like, oh my gosh, he knows how to do a flip, to move the pictures back and forth. I couldn't believe it. But he was quiet, and I was like, oh, just 5 minutes of relief. Oh, please. So I can see how parents fall into these traps, right?
Absolutely, absolutely. And we're all at fault about it. And
Yeah,
using it for 10 minutes to get that child quiet is not a big deal. But
right.
once we abuse it and go to 8 hours a day or 4 or 6, that's
Mm-hmm.
when you put the child at risk for what we call virtual autistic symptoms. So these children, when I see them and I take a complete history, that's how it starts, Donna. They figured out the screen can do that. Then it turns into 6 to 8 hours a day. They are severely autistic by then, by age 2. If I'm able to convince the parents to take it away, I can see
Mm.
normality. Like literally, the child will go from severe autism to either high functioning or normal brain within 6 months.
So you're seeing, just to clarify for our audience, you're seeing these young patients, 2 and 3, and probably older than that too, right?
Sure.
Because of eye problems, right? They're coming to you as an eye doctor. But what you're finding then is the connection to screen time in so many of these cases, correct?
Absolutely, absolutely.
Okay.
I had a 8-year-old boy who was watching the screen 8 hours a day, playing his game on online, and he was actually delayed developmentally, not severely autistic, but just delayed
Hmm.
developmentally. And then he was also wetting and soiling himself because he wouldn't go to the bathroom because we try
Right.
to hold it in until it became too late. So we decided to take the screens away, and within 1 month, all his soiling, all his bed wetting, all his night wetting, all resolved.
Okay, well, now we're going to go right into gaming disorder, right? This is a real diagnosis now, correct? And can you tell us how is it diagnosed? How many gamers are estimated to be impacted? And do you know how many are actually kids? Or just a rough estimate?
Sure.
But first describe what is gaming disorder? How does someone get that diagnosis?
So gaming disorder, like any of the other addictive behaviors that are in the DSM, the Diagnostic Statistical Manual of Mental Disorders, it's all based on criteria.
Okay.
So disorder is defined as a gaming behavior that is now destructive to a person's life, and
Right.
it has to hit multiple areas of their life. Like, for example, 5 to 6 or more areas of their life. That includes behaviors, that includes their their relationships, their job, their schooling, their finances. They're unable to cut back. They're using it to escape. You're talking about now emotional as well. And so when it affects 5 or more, then basically they are considered to have a gaming disorder. And that's defined by the WHO. And we're still behind here in the US because we haven't adopted fully that diagnostic criteria yet. So in the US, it's not considered a diagnosis, but as the WHO has defined it worldwide, they want to push forward that classification.
So, what advice would you give parents and grandparents and maybe even teachers too? I imagine they're seeing this a lot as well. If a child or someone, a loved one in their world is either suffering from gaming addictions, screen addictions, or in this case, game online gaming disorder.
So let's jump back just to your previous question though. How many kids are affected? So Douglas
Right.
Gentile did a study in the Journal of Pediatrics and showed that basically it's about 8.5%. That's a lot of kids. So 8.5% of gamers. So
Of
once
gamers.
you screen a child and you think they have a problem, and I think the a quick this is not a validated tool,
Yeah.
but the CAGE questions for alcoholics, right? CAGE stands for basically, do you think they need to cut back on the gaming? Are they agitated when you talk about
Minutes.
they're cutting back? Do they feel guilty when they game? And then E for alcoholics is an eye opener. Do they need an eye opener? I think E for the gamer stands for, do they need to game every day? Is that all they talk about?
Mm-hmm.
Because gaming, just sometimes is not enough. So I think that when you can screen and see a child who is hurting, they need to reach out to the parents and inform the parents. And that way they can then seek help and get intervention before it's too late.
So where do they get help? Where do they get support? I imagine they can go to your website, but do you recommend they see a doctor? Do they see a specialist or what?
Yeah, they should go see a mental health specialist. So any
Okay.
psychologist, any behavioral health professional can actually intervene because a lot of these disorders aren't new. It's just it's another mechanism of abuse. So these
One minute.
kids can get actually help from a standard mental health provider.
Okay, well that's great, and we're going to jump into another area, and this is an area which is really near and dear to my heart because since we started at Enough is Enough back in 1994, our focus has been preventing the online sexual exploitation of children. And as you know, uh, online gaming platforms are a predator and trafficker's dream come true. Why? Because it is a perfect grooming tool. They've got the opportunity to actually play with kids, to befriend them, to be that trusted gamer or someone that that child might look up to because they might be better, that adult might be better. So it just, and plus you've got all these features, right? You've got audio chat, you've got video, you've got the visual, you've got all of this going on that you don't necessarily have in a smartphone situation or a social media situation with gaming. You've got all these senses coming together. So it's a perfect grooming tool. So let me just give a data point here. There's a group that's global that I've worked with for years called We Protect Global Alliance. And here's what they found. Conversations with children on gaming platforms can escalate into high-risk grooming situations within 19 seconds. That is no surprise to me, and I'm sure, Dr. Doan, that's no surprise to you. With an average grooming time of 45 minutes. That's 45 minutes that it would take a sexual predator, a convicted sex offender, a pedophile, or a trafficker to what I call adequately groom a child. And what does that mean? To get that child to trust them, to see them possibly as a friend, and to begin to engage in sexual types of conversations. So, Dr. Doan, I know you know a lot about this. Could you just take it away here and let parents know really how real this is and how common this is?
Okay, so there's two concepts here I want people to understand. One is brain development in a child is not completed until age 25.
Right.
So the human brain actually matures from the back of the brain to the front of the brain. The front of the brain is the frontal lobe. That's the last part of the brain to develop, and that doesn't complete maturation till 25. That's why insurance companies give us a break at age 25 because that's when we start thinking like adults. Before then, the brain is highly susceptible to feelings, to emotions, to dopamine, to things that feel good. Okay, that's number
Right.
one. Number two concept is the Pavlovian dog response. Remember
Yes.
that science study where
Mm-hmm.
there's that little bell, and then you give the dog some food, it starts to lie, like salivating. You ring the bell. Eventually, you just have to ring the bell without the food, and it
They
still
salivate.
salivates.
Right.
When you allow a child to jump into these games, you are actually allowing that child to bond with the game. So
Mm-hmm.
things that happen in the game become meaningful bonding emotional experiences for that child. So now
Mm-hmm.
pops in the predator. The predator doesn't have to work hard. The predator is a wolf in sheep's clothing because the game has already developed that sense of security, the sense of friendships, the sense of social safety that the child has developed in that gaming environment. So when another character pops in who happens to be a wolf in sheep's clothing, that child knows no different. Now with the artificial intelligence in cloning, voices, just go to this website called 11 Labs. 11 Labs is probably one of the leading labs or the leading businesses in synthetic AI voices. You can
Mm.
pick a AI voice that sounds almost human. It's
Wow.
amazing. You can make that voice childlike, adult-like, old-like, British-like, Indian-like, whatever. And so a predator who is now communicating with that child can use voices that are appealing to that child. It can use his avatar or images that are appealing to the child. It can go
Right.
to the child's social media page and learn through the social media history what the child likes to eat, what the child likes to play, what the child likes to wear, and what type of artists and pop culture that child enjoys, and also deliver to that child those very similar things that now can trigger very strong emotional responses in the brain,
Right.
i.e., dopamine, which is what we talked about. But now you know that dopamine doesn't act alone. So the child will also have their hypothalamus pituitary adrenal axis firing, their gonadal, thyroid,
Mhm.
endorphin axes. That is why grooming occurs so quickly in a child, because they don't
Right.
have the frontal lobe to slow it down and saying, wait a minute, I think this is fake. Wait a minute, I think this is a
Of
dangerous
course.
situation.
Yes.
They don't have that ability. They just go with the flow and let their emotions just drive that dopamine, drive those hormones in their
Hmm.
body that
And
basically,
And
feels great.
predators, yeah, and predators know how to groom. And I just want parents to understand this is happening across all platforms. And kids are knowingly talking to strangers. But I interviewed a convicted sex offender a number of years ago, John Doe, and he talked about, I said, John, he was in a high security prison. I said, I want you to explain to parents how you get kids to trust you. And he shared all the things, Dr. Doan, that you just shared. He said, I can be anybody that that kid wants me to be. They want me to be a cute 16-year-old girl. I can find a picture of a cute 16-year-old girl and I can be that girl. I can disguise. And now you've got AI, but on gaming platforms, you've got voice masking technology. And they can find out all their habits. So as they're gaming, they're building friendship, quote unquote. And these are common grooming tactics. And it really is, every parent really needs to pay attention to what's going on here. We're going to talk about how to prevent these things, but we're going to take a short break here, about a 2-minute break, and we're going to come back. And Dr. Doan, we're going to go right into something that I know that you understand a lot, and that is the violence side of these games. And so we're going to take a quick break. Everybody, please come back and join us in 2 minutes. And thanks again, Dr. Doan. We'll see you after the break. Welcome back, everyone. We have been talking to Dr. Doan, who is an extraordinary expert in the area of online gaming, addiction, screen time, excess, et cetera, et cetera. And the first part of our show, we talked a lot about the dangers, and we're going to hit one more big danger here with respect to online gaming, and that is violence. I know a lot of parents and grandparents have been concerned about the amount of violence in some of these games, not all of them, but in some of them. And I learned something after Columbine. I was invited to testify before Congress after the Columbine shootings on the role of the internet. But there was another expert there who testified about the violence in online games, and they have found that the shooter had been playing video games and violent video games. And what he said, this was Dr. Grossman. I just found it fascinating. And Dr. Donna, you alluded to this in our first segment. And that is, he said, the same types of technology that are used in these violent video games is the same type of technology that the military is using to train soldiers to kill. He said, we're actually training these soldiers to be to be killers. And so he said, why would we think that if this technology is effective in this way, as it is in the military, that it wouldn't have a negative detrimental impact on young kids? So Dr. Doan, you take it away.
The research on violent video games and behaviors is very complex and complicated. And there are few things that people need to understand is that the research methodologies themselves need to be considered. So if you're going to look at these research studies, you have to look at the materials and methods. What I mean by that is that when you read the materials and methods, what type of violent video games are actually being studied? Are they actual super violent games, or are they just semi-violent games? Are they just kind of like the boxing games or the violent, maybe cartoon type of shooter games that you see and some of the kids play that are like rated PG-13, or are they the first person shooters with graphic detail of how to kill and reward people for positions of headshots and upper body shots like Call of Duty and also Grand Theft Auto? what you'll find is that most of the research are not done consistently, number one. Number
Mhm.
two, when they are done on violent games, let's say more of the extreme violent nature games, they are done on young adults, young, healthy adults. They're being recruited from college campuses. So then, the effect on them is going to be different than effect on a 2 or 3 year old, for example. So, and then finally, you have to look at the age group. So most of the violent video games are not studied on kids, like meaning, 8 and younger or 12 and younger, or even 8, 17 and younger,
Mhm.
because institutional review boards who are responsible for looking at research protocols do not allow, will not permit throwing mature only, content to children, to particularly young children. Because if you show how a young child, for example, when they look at something, there's something called monkey do, monkey see. That came
Yes.
from, I think, mirror neurons, which came out of monkey experiments, where it showed that monkeys, when they watched their
Mhm.
other, monkeys, or they watch other human beings learn how to peel a banana, for example, they themselves can learn how to peel that banana because what they see, they can
They
replicate
imitate.
that in their head because of these mirror neurons. Well, human beings, we have the same thing.
Mhm.
So what we see, we can actually replicate. That's why in medical school it says, you watch one and then you do one and then you teach one, meaning that if you watch a procedure, the next one you do the procedure, and the third time you teach that procedure. So we have the ability of mirror neurons. So kids, for example, if they're watching violent gaming, they are going to replicate those behaviors because that's how their brain works. They don't have the frontal lobe. So using what Dr. Grossman's has said, these programs use the same technology as law enforcement and military. These programs using the same technology are highly effective billion-dollar training tools to increase lethality in our military and police.
Right.
So why are we so foolish that if you take the same technology and give it to a child, a young child, and expect a no effect?
And even a preteen child, because we know those vulnerable ages between 12, or I'm sorry, 10 and 13, they're turning, they're in that adolescence, they're going through puberty, their hormones are already shifting, they're maybe more interested in the opposite sex. That brings up the whole pornography, sexual content in here. And so you've just got really a toxic mix here in what can happen to a child's brain, to their behavior, and really their templates for life if this continues and there's no intervention. So, Dr. Doan, we've got a little bit of time left, and we talked about all the negative, a lot of the negatives, but we really want to help parents and anyone listening understand how to prevent these risks. First of all, because prevention is worth a pound of cure, right? It's worth a pound of cure. So let's talk about some of the prevention. First of all, is there a safe age to allow kids to play online games? I said online games. So parents, let me preface what that means. That means they can play with someone else online. Dr. Doan.
Yeah, I'd say, when they're 18, that's when they're
Okay.
safe to play online with other people. And that's random. But if you want to play online with your child because let's say you're a grandparent and
Mm-hmm.
or you're a in a divorce situation and you want to play, games with your child, you can play through the internet and just make sure that child knows that the only person or time that they will play on the internet with other people is with, the grandparents or with with a family adult. And I think
So,
that would be appropriate. But you have to really trust that child, and you have to make sure you monitor and follow up and make sure they're not sneaking more gameplay because it's not going to be good enough just to play with the grandparents because eventually, they're going to try to seek other more challenging players to encounter.
we talked a little bit about this prior to the show, but I want our guests to hear this. Is there a way for a parent to select a parent approved gamer list, like just say grandparents, cousins, and a few friends that they approve of, so that they are actually playing online, but they do not have access to anyone else that is a stranger or a dangerous person.
That's going to depend on the type of games they're playing. It's nothing out there right now for a platform-wide implementation.
Okay.
So any of these things are very difficult to really make sure. And that's why if it's too difficult for you, I'd say take the games away. So no online play whatsoever. And the only time they play with other people is get some pizza, popcorn, candy, soda pop, invite people over or kids over to the house and let them, have gaming parties. I think that would be fun. It promotes social interactions.
Mhm.
It promotes friendships, and it actually prevents isolation, meaning that, someone sitting alone in their bedroom playing by themselves.
Right, which is a no-no anyway, right? I mean, we say to parents, quite frankly, laptop, computers, gaming consoles, should they be in a bedroom? I know that there are controls, obviously, and we're going to talk about those, but let's just talk about this. This is practical, but this kind of goes in the safety rules and software tools we teach parents. The rule for the parent is just technology in the bedroom is just not really a good idea, is it, Dr. Doan?
Exactly. We always say take the screens out of the bedroom. The bedroom is for sleeping and for rest. And the problem with the games in there and the screens in there, it actually causes sleep deprivation. And sleep deprivation can lead to a whole host of other mental and mood problems, and also just delay in their development. So just get it out of the bedroom. I agree.
Just get it out of the bedroom. Okay, that's easier said than done, right? Because
Oh
anytime
yeah, it's a battle.
it's a battle. It's a battle. But okay, this is to the young parents that haven't introduced technology yet.
Ah.
Be careful. So let's just talk about when to introduce technology.
Yeah, so
Um,
so if you have a child that's going to be born or young, I would say no screen time until age 2. Nothing. Now, the American Academy of Pediatrics, they changed it to 6 months because so many
oh,
parents wanted to use it early, but there's no really good data for that. The
okay.
best thing is to delay it. And so no, no, okay, so let me emphasize why delay it. If you look at the tech executives who send their kids to these schools called Waldorf schools, they actually sign a contract where they say no technology, no screens, nothing, not even the use of internet until age 16. Okay.
Right.
So they want to let the brains develop in these children. So Waldorf schools did a research study to show it only took 6 months for those non-screen natives to catch up to all the other kids who got screens early. So it really won't delay your kid, but actually will propel your kid forward if you delay the screen. So delay until age 2. Now at age 2, introduce maybe half an hour a day. But
And
if you
what would
do,
that look like? I mean, that would that be like Miss Rachel, for a 4-year-old? Or does screens include TV or just a digital
yeah.
screen, a
So
computer or
Miss
a smartphone?
Rachel, you're talking about Miss Rachel on YouTube, right?
I love
So
Miss Rachel.
she's cute, but the problem is she changes scenes too quickly because our babies have been trained. We've been trained to want scene changes every 5 to 6 seconds.
Hmm,
That can lead to actually ADHD because that's what ADHD is, right? Changing scenes all the time and programming the brain to always looking for something new. So if you take this generation of kids, they can never sit down and really watch a podcast like this. This is too slow for them. Their brain is always looking for something to change every 5 to 6 seconds. So what I would say at 5 to 6 seconds, try to look for something that 30 seconds scene change. So like Mr. Rogers, like the old school
hmm.
1970s Mr. Rogers. So go to like, get the DVD set from Amazon. I know Kirk Cameron is coming up with his own children's show, and I'm not sure. I haven't seen the scene changes yet, but you can actually,
Right.
just whip out a stopwatch and see how
But
fast are the scene changes. And
boy,
this is
that's
actually
incredible.
scientifically proven too, out of like University of Seattle, the work by Dr. Christakis. And so I'm not just saying, you know, these scene changes, are benign, and I'm just making this up, but they are serious. They're not benign. And so basically if you look at that, I would say, until they're like preteen years, half an hour to an hour a day. So you can actually bump it up a little bit when they're 5 and 6, go to an hour, and then you can bump it to like Little House on the Prairie. Remember that series?
Oh
So
yeah, all the
then
stuff
when
we
they're
were grew
watching,
up on, right? I Love
yes,
Lucy. Yeah, all the good stuff.
yeah,
Andy Griffith. So, oh my
exactly.
goodness, it is probably now going to be very hard for a parent who brought their kid up on Miss Rachel and then moved to these fast-paced cartoons and these online video games to even back it up, right?
You
So,
can't
so
back it
let's
up.
say the
Yeah.
cat, yeah, Pandora's box has been open. All right. Um, what do parents do? How do you can you
Mm.
you can't really back it up. You can't put Pandora back in the box. And I love this graphic on your website, Dr. Donna. It's so great. It's walk us through what should parents do in order to prevent these things, in order to deal with problems even before they come up. If you can walk us through that graphic.
Okay, so to prevent problems, right? So screens out of the bedroom, no smartphones until age 14. So that
Yes,
means if you need to contact your kid, you may want to use like a flip phone
a
instead.
flip, a
If you
gab phone or something.
Yes,
Yeah.
exactly.
Mm-hmm.
And if you want to give them an iPhone, because there's now, I've seen some social status issues where if you give them a flip phone and, they get made fun of, and some kids can't handle that very well, give them an iPhone, but lock it down like a regular flip phone, meaning that
Right.
you don't give them internet access, no app
Exactly.
store, access, only, really just phone and text, the limited number of people they know.
That's right. And a
Um,
parent can set up who they can call and who's got
right.
access to that phone and everything else. Okay, keep going because then
That's
we're going
right.
to get into the tools real quick. Go ahead.
An hour of videos or hour screen time, hour of exercise per day. So you just go 1 to 1. So
Okay.
that way, they are exercising, they're moving around, getting healthy. And if you see any signs or symptoms of screen addictions, and you can go through the cage questions again. Do you feel like your child needs to cut back? Are they agitated when you talk about reduction of screen time? Are they, throwing temper tantrums and so forth, right? Are they sneaking and feeling guilty about their playing? And then are they talking about it every day? If they have any of those things count as yes, then they may have a problem. And if they have a problem, consider a digital detox where you
Right.
literally take everything away for a month and just let them kind of just let their brain reset. And then after their brain resets, then you may want to reintroduce the more appropriate screen time activities, such as, the Mr. Rogers and the Little House on the Prairie and those types of shows. And if that doesn't work, then you may have to go longer in detox because you may have somebody or a child with a really bad addiction, and you may need a mental health provider now to help you,
Mm.
intervene. You may need medications because it could be so bad that there could be, a need for antidepressants or anti-anxiety
Oh
medications.
my goodness, that's so scary. It's such a young age, isn't it? Um, I want to talk a little bit about the tools on these gaming platforms. We recommend it enough is enough, and it's easier on other kinds of platforms like a desktop, etc., or even a smartphone to turn on filters, to set the parent approved buddy list, to set the privacy settings and those kinds of things. I know Xbox does have something like this, but Dr. Doan, how effective are they? Should parents really go in there and at least try to use those tools because it might mitigate some of this? In addition to setting those screen times, and setting screen times are, I think, are very important because then it's not the parent, saying, "Hey, time to get off the screen." The gaming console just shuts down, or the internet access shuts down, or whatever shuts down because time's up. And you can set those time controls for each child. So, for instance, an older child might have more time. And I'm not just talking about games now, but I mean, you've got homework, you've got all kinds of things, once you get onto a
Right, right.
desktop or a laptop.
I think it's worth giving those tools a try, but the problem with the internet is that there's nobody validating the actual individuals that join these gaming platforms. So a predator, that's what we're worried about, is them playing with somebody who's inappropriate. these predators aren't vetted, so they can just, cancel their account, make a new name. So it's kind of like whack-the-mole problem. They just keep on popping up more heads. And so I think it starts with educating the child and discussing with who's appropriate to play with and who's not appropriate, and to seek help if they feel uncomfortable or they feel like they're being, you know, um, pursued, or it's really tough. And that's why I say it's just better to let not, it's better not to let the kids on until they're 18, because the online world is like the
Yeah.
wild, wild west right now.
And it still really is. And so thank you so much for that. I'm going to give a couple of little safety tips myself here, and that is for parents. Always keep the lines of communication open and talk to them about the fact that, once that connection is turned on, whether it's a smartphone or a gaming console or a laptop, it's all the good and it's all the bad and it's all the dangerous. And it's up to you, the parent, to be the parent, right? Because not that you don't trust your kids, but you don't trust the people out there who might want to hurt and harm your kids. So have those communications open and be the trusted adult that they can come to, because this is really, really important. And recognize the fact that once you give that child a smartphone, or you give them any type of internet connection, like I said, the genie's out of the bag, and really, in a way, their childhood and their innocence is over at that point. And that sounds scary, but it's the truth. So Dr. Doan, we've got a minute left. Let folks know real quickly how they can get more information about you and your work.
Great. So you can go to my website at andrew-doan.com, and my work's there. All my research papers are listed there, as well as the links to my social media sites. And then just come to my YouTube channel at youtube.com/ at Dr. Andrew Doan, and
Great.
and watch some of my videos on virtual autism, ADHD, digital detox, and then
Thank you.
also other various videos I'll put up over time about this
Thank you.
topic.
So Dr. Doan, it was so great. We've got to do a whole nother show on this, but thank you everyone for joining us. Please go to internetsafety101.org, get our quick guide on online gaming, and find more about Dr. Doan as well. And until next time, take care and God bless y'all. Thanks again.
Thanks for tuning in to today's episode of Internet Safety with Donna Rice Hughes, designed to educate, equip, and empower you to keep your children and family safe in the digital world. Until we talk again, have a beautiful and safe week.